my name is Brenda Tamayo.
And my name is Priscilla Hinojosa.
And we're both dental hygiene students at UT Health San Antonio. Today we are going to be demonstrating the teach back method on how to brush and floss properly. So today I will be the clinician and Priscilla is going to be my patient. Okay, Priscilla, can you tell me a little bit more about your brushing and your flossing routines?
Yes, of course. So I usually just, I just go around, straight movements all around my teeth. Like this. Just,
Okay.
And at times, I don't know, I tend to brush, just like this. And there's been days I feel my gums, my teeth kind of sensitive.
Okay. Do you put a lot of pressure when you brush?
I'd say so. I usually use a hard
The hard bristle
toothbrush, yes.
Okay, and then
as to flossing, well, I'd say I only floss once a week. Yeah.
Okay, so I'm going to be showing you a good method on how to brush your teeth. So for this method, you're going to hold the toothbrush at a 45-degree angle. So for the top teeth, the bristles are gonna be facing up, okay? And you want to have it angled like this so that you can get a little bit below the gums. That way you can, remove any bacteria you may have. And you're gonna use circular motions, okay? Like this. And you don't want to put too much pressure because maybe that's why your gums are a little sensitive, just enough to where you get all that bacteria out. Now for the lower teeth, you're gonna hold the toothbrush at a 45-degree angle as well, but the bristles will be facing down, of course, to get all that bacteria between the gums and the teeth out. And always using circular motions. Now for the front teeth, for the inside of the teeth, you're going to hold the toothbrush at a vertical angle and then, brush up and down like this. You want to do up and down strokes, and the same thing would be for the top teeth, okay? Vertical for the front teeth on the top, and then up and down strokes. And now for the top surfaces, you can do back and forth strokes like this. You want to make sure that you get all the bacteria out from the top surfaces, because that's the surfaces we use to chew. Now I can show you how to floss. We want to make sure you floss at least once a day, especially before going to bed at night. And you're gonna want to hold the floss with your two middle fingers, and then you're gonna help yourself with the index finger to push down, and then the thumb, okay, to push up. Okay. So you want to go in between all your teeth, and you might want to do a saw movement like this, kind of back and forth, so that when you get the floss down, you don't cut your gums. You want to get a little bit below the gum right here. That way you can remove any bacteria you may have there, and then push up with your thumbs to get the floss out. Okay, you want to get about 18 inches of floss. That should be enough to get around the whole mouth. Okay. So I'm gonna have you show me. I just want to make sure that you understand the method I showed you. That way you can apply it when you get home.
Okay, so as you mentioned, I have to hold my toothbrush with the bristles up at a 45-degree angle.
Yes.
Going all around my tooth surfaces, doing circular movements all around. And that's for the top and bottom teeth, as well holding it at a 45-degree angle and brushing the inside surfaces. I want to slightly go like near the gum, not too harsh because that may hurt my gums or cause sensitivity. And you also mentioned to hold it at a vertical angle on the inside parts, doing back and forward movements. Same for the top.
Very good.
And then as for the floss, you told me to use my middle fingers to wrap it around. And then use my index finger and my thumbs. My index will help me to bring it down, and my thumbs to bring it Oh.
Mm-hmm.
Okay.
Very good.
And then I want to go in between the areas. Once I feel like a little bit of pressure, that means the floss is down there. I want to bring it slightly down near the gum without pushing too hard. Then trying to move it back and forward. And trying to remove all bacteria on the surfaces in between. Then I'm just going to bring it up with my thumbs.
Very good, Priscilla. So I think this method will help you a lot. I think your gums are going to improve a lot as well. Just make sure you want to, brush for about 30 seconds in each, side of your teeth. So like 30 seconds on the top right and then 30 seconds on the top left, and same thing for the bottom, okay? So the total time would be like 2 minutes. You don't want to take less than 2 minutes. And remember to clean the outside surfaces, the top surfaces, and also the inside surfaces of your teeth, okay?
Sounds good.
Alrighty.
Thank you,
You're
Ms.
welcome.
Brenda.